I see a lot of babies full of eczema all over their body, and they're just brand new babies.
Mm,
And I never knew why because they're such a new baby. Do you think that a lot of that is fungal related or mold related?
yeah, yeah. Especially to this example.
Have you had patients where they're suffering from PANS or PANDAS and they get on some type of antifungal and they're improving greatly and they're also getting out of the environment?
Yeah, yeah.
If you have a child or you know of a child, or if you are suffering from eczema, psoriasis, gut issues, persistent gut issues, no matter what you do or what protocol or diet, or if you're suffering from neurological issues, anxiety, inability to concentrate, suffering from the inability to learn, or struggling with learning or concentrating or being able to focus on one task. If any of these things are symptoms that you suffer with, you want to watch this interview. Hey guys, my name is Judy Cho and I'm board certified in holistic nutrition. And I have a private practice where we have worked with over 2,000 carnivore clients and patients get to root cause healing. And that often starts with the Carnivore Cures all meat elimination diet. That is a mouthful. Today, I had the pleasure of sitting down with Dr. Pejman K. He is an integrative pediatrician, meaning that he works with the entire body, considers everything environment, body, diet, etc., as he works on pediatrics, very little littles, trying to get them to root cause healing. For some reason, there are children that are always constantly sick. And in this conversation, we talk about all the common symptoms or unique symptoms that we tend to see that oftentimes are related to mold illness. We talk a lot about other illnesses as well, but we talk about how for many children and many symptoms, including neurological, that are related to mold, even though we don't think it has anything to do with mold. Dr. Pejman talks about the differences of eating grains and peanuts and wheat and foods that have or contain mycotoxins, and then the differences of why water damaged buildings are possibly more harmful than when you are consuming something. He talks about the importance of the gut and how the gut can be affected by mycotoxins and mold. This conversation is amazing. There's so much information. We banter back and forth about a little bit about the science. And ultimately, we hope you find that healing is possible. And even with mold, even with limited resources, there are always things to do. The human mind is so smart and brilliant that if you want a way out, there is always a way. Even if the evidence based answer is this cookie cutter box, and that is the way to heal from mold illness, there are sometimes some ways that you can find ways to literally think outside the box for healing. I know it's not for everyone, but if you are limited in resources, you should still fight for healing because that is ultimately what we are trying to do. And I respect Dr. Pejman so much as he shares his own journey and why he is so passionate for children for this not so ideal situations and illnesses that we would never consider are mold. Before we get into the interview, please make sure to like and subscribe and hit the notification bell as this allows me to get my content more out there. Okay, guys, let's get right into the interview. Hi, Dr. Pejman. I'm very excited to have you on. I'm excited for our community to get to know you better and all the excellence and brilliance you have. So, for the people that are listening and watching that may not have heard of you, if you can introduce yourself.
Sure. My name is Pejman Katiraei. I'm a pediatrician who has been doing integrative medicine since, geez, about 2008. I got into integrative medicine just because I felt that conventional practices had big gaps. And it's not to say conventional medicine doesn't help. I mean, there are things like steroids and antibiotics and so forth that I think have a very valuable place. It's just that by itself, any medical model by itself is not sufficient. So, as I started looking as to why the kids that I serve are struggling and why they had their challenges, I started looking into this world, and it's been a learning process since. I certainly have not figured everything out. I'm still learning as much as everyone else, and really, at the end of the day, the intention and goal is to do the best I can to help as many kids as possible.
No, and I love that. And thank you so much for being on this mission. It seems like everyone is sick, or we normalize, like I see all kids have a little bit of allergies or a little bit of asthma, and we just say, oh, our child has a food sensitivity. Is it that chronic illness has become more common, or that we are just more aware of it? And so it just seems more common, but actually we're just more educated.
I think there's a certain degree of awareness that could be used to describe what we're seeing. I certainly don't think that that's all it is. And I mean, pretty much every disease process, whether it's asthma, allergies, autism, ADHD, pediatric, neuropsychiatric conditions, there's, this pediatric acute onset neuropsychiatric syndrome PANS that wasn't even around 20 years ago, or certainly wasn't as prevalent as it is now. So I think you could make a very strong argument that all kinds of chronic conditions in talking about the pediatric population have increased in significant ways.
And what do you think is exacerbating that? Like, what is making children sick now compared to even 30, 50 years ago?
Toxicity. I mean, at the end of the day, I think what we have done to our food supply, what we have done to the environment, and then you add to that psychological stressors, and now COVID has showed up into the picture. Like, we have created this. I mean, I hate to call it an experiment. We have essentially created this human experiment of introduce all of these different stressors that the human body was never really designed to handle in this form. I mean, the human body is meant to handle some stress. It's meant to handle some toxicity. It can do that with ease, but it was never designed to handle this level of toxicity, if you were to say. And I believe there's a tipping point where the human body, and especially these little ones, where their physiology just kind of hits this wall, and especially within the gastrointestinal tract and organs of detoxification and the mitochondria, they just start falling apart, and they enter this chronic cycle of dysfunction, toxicity, inflammation that they are unable to come out of until someone intervenes.
And I know you've mentioned before that in your practice, you started seeing a certain type of illness become so common. Can you share a little bit of maybe just the story of how you started seeing mold as a factor?
So this is now going back probably about 7 years ago. I've always cared a lot about kids with learning and behavioral issues, and part of it is as a kid I had a lot of those kinds of things: high anxiety, not borderline suicidality for a period of time, pretty intense ADHD, probably some form of Asperger's, and these kids have a very big place in my heart. And around 7 years ago, between the diet, and I've been trained in herbology, and I'm technically an osteopath. I had all of these modalities at my disposal, and I'd say about 40-50% of the kids in my practice were responding pretty well. And then there was another batch of kids that just nothing moved the needle. And I would try diets and supplements and everything. Nothing would help them. And there was this one beautiful little boy who had a severe form of neuroinflammation, like a high aggression, destructiveness. At one point, the mom called me crying because he was chasing after her with a knife, kind of, borderline psychosis. And, she was the one that actually said, "Hey, could this be mold?" And, I thought I knew something about mold. And she's like, "Hey, could this be mold?" I'm like, I sure as heck don't know what the heck is going on. So why the hell not? So we did a urine mycotoxin test, urine mold toxin test, and it came back kind of positive, but nothing that looked scary. And then next thing I know, she's like, "Hey, I found this guy, Dr. Nathan. Are you open to doing a consultation with him to look at the results to see if this is real?" I'm like, I don't know. Again, I'm like, I don't know what the heck to make of what's going on. Sure. So we got on a call with Dr. Nathan, and I will never forget this call. Like, within 10 minutes of describing his symptoms and him looking at the urine result, he's like, "Oh, this is for sure mold." I'm like, what the heck are you talking about? Long story short, mom brings in an inspector. Their home was so contaminated that literally she just walked out with a handful of clothing, no furniture, no nothing, like that kind of contamination. Fast forward, he got better. I started opening my eyes, started training with Dr. Nathan. And, I hit this point where about a year and a half into my training, I go to him. I'm like, Neil, either I'm losing my mind and I'm going completely crazy, or mold is everywhere. And I'm finding it in all the kids who are, badly affected. And am I crazy or is this real? He's like, no, welcome to my world. It's real. And it's not to say mold causes everything for everyone, but by no means. There are plenty of other things. There are areas of this country where glyphosates are sprayed around like water. Heavy metals, sadly, are still common in parts of the country. And, not to discount everything else that's out there. But one of the things that's really unfortunate, especially in, some communities, is the impact of mold. And, when you compound climate change and the floodings that now take place everywhere, right? California used to never flood. California is desert. Now California floods, right? Arizona floods, Nevada floods. Forget about, parts of the South. And with this exposure, especially in little kids whose gastrointestinal tracts are yet developing, immune systems yet developing, those kids, if they're genetically vulnerable, could really be harmed.
Can you share a few case examples where like what would bring in, so you brought up one about the neurological and maybe some of that anger. Are there other case examples where some kid came in, maybe it was a skin infection or something, but then you find out ultimately that it's maybe mold related?
Yeah, if you step back and you look at what are the things that could really throw off the immune system, right? So, like in the case of that child, his nervous system was impacted by his immune system. So we step back and say, well, what are the things that can impact the immune system in a really significant way? There are only a handful of things. So mold has absolutely been tied to atopic disease, allergy disease, right? So chronic sinus infections, chronic respiratory issues. There's one really well done study looking at adenoid enlargement. So kids that are exposed to mold in damp environments get adenoid enlargement. So immunological allergic reactions have been, pretty clearly tied to mold. I can tell you in my practice, the kiddos that have, pretty significant asthma, like the ones that need to be on regular inhaled steroids, those poor kids that end up in the emergency department, end up hospitalized, at least in my Southern California practice, not to say it's the same everywhere. All of those kids were exposed to mold. And as a follow-up, when we took care of the mold, pretty much all of the kids are asthma free. And like in my entire practice of, I don't know, 400 kids, not a huge practice, but out of 400 kids, I have maybe two kids on steroids. And those were actually kids that were exposed at some point in time or had RSV. But it's not like a quarter of my population is on steroids. All the kids that I've seen who have significant eczema, I'm not talking a few tiny little patches that you get rid of gluten and they get better. I'm talking about the poor kids that just have one skin inflammatory condition after another and they're itching and so forth. All of them have been exposed to mold. So there's a unique picture that shows up in kids where either they're robust and they're healthy and they just have vitality and they fight off infections and their immune systems are strong or balanced. And the kids that are not, the kids that get sick all the time and they have one ear infection after another, and then they get pneumonia, and then now they have asthma. And that picture of immunological disease, that imbalanced immunological state, which can also show up here with anxiety and inattention and autism and so forth, could be related to mold.
Yeah, it's interesting. I was looking at a study and it was saying something like 98% of sinus infections are actually fungal infections, and it's not just some type of infection. And a lot of the things that we are normalizing, that we think it's normal, that my child has a sensitivity to a certain food or a certain environment, or they have seasonal allergies, or they're just their gut is a little leaky is actually a lot related to mycotoxins and mold and their exposure to it, which then makes their toxin bucket, if you call it that, full. So then they're becoming more sensitive. And so then everyone is targeting, and we do this for the adults too, but we start targeting, okay, so I just need to figure out the food sensitivity. I just need to figure out what gut support I'll need, but they're not getting to the root cause that oftentimes it's mycotoxins and mold in the home and the buildings. And it sounds like that's what you are seeing as well.
Yeah, I would say hallelujah to that. Uh, yeah, there are kids where you cut out some gluten and dairy, you put them on a probiotic, nothing fancy, a little zinc, maybe a little vitamin D, fish oil, and they get better, right? Eczema, skin issues, congestion, coughing, they get better and everyone's happy. There are kids that have 15,000 food reactions, and the parents are like, well, Jesus, like I can feed my kid like four foods, right? And I was guilty of this where I would be like, well, you need to get rid of gluten and dairy and this and that and that and that. And after doing all of that, they still wouldn't be better. And, that's when I started asking this question of like, what the heck is derailing the gastrointestinal tract like that, right? What would cause such significant dysfunction in the gastrointestinal tract that would allow this degree of reactivity to take place? And I think as we step beyond this mindset of, well, let's just get rid of the foods, and it's not to say like we shouldn't do the eliminations, right? But if you step back, and I just had one kiddo that presented with various neurological issues, and the food allergy panel came back, and literally 70% of the foods that we tested on that food allergy panel were positive, to the point where you look at it, you're like, well, God, if we're to follow this, they might as well just stop eating. uh, so to your point, like if we reverse this mindset or step back and say, well, what causes all of this reactivity? What is behind that? That's where the conversation of mold oftentimes pops in.
So we have mold in our homes because of water damage. And maybe it's even in our foods because of the way that grains, for example, are stored, or it's in the meats that the animals ate these moldy foods as well. How does it manifest in your gut, as you mentioned, or in the brain or on the skin? Like, how does mold do that to my gut?
Great question. And I love where you're going with this. And I think it starts with that, kind of toxin bucket you talked about. Sadly, I mean, there's no human being that's not exposed to toxins. Even the organic eating, healthy living people have toxin exposure. And these toxins through our food, through, water, environment, essentially start degrading the microbiome. And, as I've looked at least in these children, what I've become convinced of is these toxins start causing a certain degree of leaky gut. They start causing a certain degree of gut inflammation. And most importantly, they start impacting the bacteria that are in our intestines. And for some people, depending on their genetics and so forth, they have a certain threshold that they can handle this toxin load within their gut. And then you've got the liver that can detoxify and so forth. When that toxic burden increases past a certain point, and for those people living in farm country, it could be the glyphosates just keep getting sprayed in your face, and the glyphosate level increases, or the heavy metals, or whatever it is. Once you get past a certain point, the gut is no longer whole, and you start getting this degradation of the zonulin proteins, the gluten proteins. And what's really fascinating is there was this 2017 study by this group led by, I think it was Akbari, Akbari. And one of the fascinating things that they demonstrated with mycotoxins is that mycotoxins that are inhaled, so we know that inhalation of these mold toxins from our environment allows it to go into the bloodstream. And what they demonstrated is these mycotoxins coming from the bloodstream, coming back into the intestinal tract from the circulation side, were capable of causing more harm to the gut itself, so causing inflammation, causing leaky gut, than if we had ingested it through the foods that are, contaminated. And the study that they did, clearly demonstrated that small amounts of these toxins, and you can translate that, for air pollution or glyphosates or whatever else, that from the systemic side, the damage that these toxins can induce into the gut is potentially far more significant than anything that we would consume. Because as you touched on, sadly, our meats are contaminated with mycotoxins and our grains are contaminated and cereals are and so forth. But the gastrointestinal tract, the way it was designed, was to be able to handle these toxins to some extent. And the bacteria that are in the intestines can actually degrade these mycotoxins. But when the mycotoxins are essentially coming from the back door, they're kind of blindsiding all of our protective mechanisms and causing significant harm, which then causes everything to fall apart.
Do you see that in your practice? So we'll see people that'll go on a mold protocol and all they're doing is removing all, the carbohydrates, the grains, the sugars, and everything that will support fungal overgrowth, but they're not really, and obviously they're remediating the home somewhat, but not maybe to the level that a immunocompromised child needs. Have you seen that by just removing the dietary part, can a child improve a lot versus the fixing the things that are causing the inhalation of mycotoxins?
Yes. So again, I think it depends on the child and
Okay.
how significantly they've been impacted, and also the level of contamination. And I say this because there are a lot of families that are, you know, given this mindset that unless you move or you perfectly remediate your home, you're kind of out of luck. And sadly, a lot of families don't have that opportunity or option. They're renting, and I've had families where the landlord's like, sorry, like, they hire the I hate to say this, the schmuck inspector that comes and intentionally probably does a half-ass job, and they take one sample from inside the home. There's no mold here. Everything looks fine.
Right.
And there's mold. So a lot of these families don't have an opportunity to just perfect their environment. And where I'm going with this is, if a child or a person hasn't been significantly exposed, what I find is with some filtration and deep cleaning and, just some things that any person can do, a lot of times that's enough to move the needle. And then when you drop the toxin load by getting rid of, the grains and these contaminated foods, that further reduces it. And then as you control the inflammation in the gut, that then allows things to move along.
We found in our practice that so we try to help people create like safe rooms where they can clean that room. Maybe there's the least amount of water damage. But if the HVAC is contaminated, it becomes so much more difficult because then the bad air, if you want to call it, gets everywhere. And then you can't really stop that, even if you were to cover. And have you seen any like nuance like that, or has the safer room still been a benefit?
I think it could absolutely be a benefit. And I mean, to your point, like, I've had some families where, especially these kids that are either on the spectrum or have neuroinflammation, so they're very, very reactive and sensitive to mold. So they're doing fine, they're doing fine. And then, summertime comes, family starts running the AC. And I had a few kids where they were doing great. And then all of a sudden, like, everything falls apart and there's aggression and sensory issues and all kinds of other things. And the parents are like, we don't know what's going on. I'm like, so what changed? And they're like, well, we started running our air conditioner about a month ago. I'm like, okay. I also want to say that it's not always doom and gloom, right? There are times where, again, by doing some things, cleaning the AC unit or putting in a proper filter or just running HEPA filters throughout the environment and doing some cleaning, that we don't get that picture. And I believe that the more we can understand how to help people heal with a controllable level of exposure, and we're not talking, the ceiling is about to collapse,
Right.
the more we can get this kind of healing opportunity out into, the larger communities. Um, because I was taught that you have to get rid of all of the mold, and if you don't, people can't heal like that. That's the way that I was trained, and I'm a part of multiple organizations, and the more I talked to people and the more families I met, and the more I started really just looking at the real world, I got to a place where I'm like, well, that's not realistic. Like, yeah, if you've got a family that has endless resources, yeah, that they can, spend $150,000 and tear out, half the home and put it together, presuming they even own the home.
Right.
But there are lots of people, good people, hardworking people that they're renting or they own the home, but they're kind of living paycheck to paycheck, and they're affording their expenses, but they can't afford $80,000 of repairs, and sadly, insurance doesn't cover this. So that's where I've really become convinced that we have to find a different way to help people heal. And it's not to say that it doesn't always have to happen. There are some times where remediation is the only option, or leaving the home is the only option. But fortunately, those scenarios are, maybe 20% of the time, but that leaves, let's say, 60 to 80% of the time where there are ways to control it.
So when I first got into the mold space, I heard the same thing where it's if your environment isn't clean enough, you'll never heal. And I think it really depends on the individual. So we work mostly with adults. We've worked with children, but I also think children are a lot more resilient. But with adults, maybe because they've been sicker longer, and we'll see paperwork where they'll say, yeah, I lived in a
Mhm.
moldy home for 20 years. So their level of inflammation is very, very high. And it might take a lot more of a pristine place to get better. But there are people that maybe they'll remediate, maybe they'll get in the safe room and they'll do a lot of cleaning. And they just have to be honest with all the other things they do. And it's the goal is to get that toxic bucket down. So, yes, maybe mold takes a lot, but so does your perception of the world. So if you're scared of going into every single place, and then that affects your nervous system to then release cortisol, or you've had another infection and you don't even know about it, or there's trauma in your past, all of these things absolutely affect our bucket. And so ever since learning about mold illness, we had to create a mind body program because we saw that was a huge factor as well, where people think I will do all the emotions to get better, but I don't know if I'll ever really get better. I don't know if I'll ever get over my chronic illness. And I see the same thought process, even though people are trying, they're not, their heart or their mind is not fully believing because they've been to so many doctors. And so I think what you're saying is so important because you're right. Not everyone can afford spending $100,000 to fix a home. And there's no guarantee that they're going to do the remediation right or have a level of the home being pristine that then they can finally heal. And if there was that guarantee, maybe they would put all the money there, but there isn't that guarantee. We also have stories where the remediation doesn't go right. And now they're in a lawsuit because they didn't do it right. And now I'm actually sick and my ERMI hurts me too score is worse. And then what do you even do with that? So I appreciate your message because I think you have to work with the one-on-ones to see where it's not this like cookie cutter answer. I wish it was, but it's not. One thing I wanted to ask you though is I see a lot of babies full of eczema all over their body and they're just brand new babies.
Mm.
Do you think, and I never knew why because they're such a new baby, do you think that a lot of that is fungal related or mold related?
Yeah, yeah. Especially to this example, I believe in what I have seen is those babies that have that kind of intense reactivity, that they have a fungal dysbiosis, and there's probably candida
Okay.
oftentimes being the primary actor. And how I've learned that, when a lot of these little kids, when I put them on nystatin or other antifungals, their eczema gets significantly better, and sometimes that happens within weeks. And I've had some cases where horrible eczema, like head to toe, inflamed, scratching, bleeding kind of eczema, completely went away with the antifungals.
Wow.
So I think there's absolutely a piece to that.
And is it because the mom, while pregnant, was exposed that she had candida overgrowth and then gave some to her child? How does that happen when the baby is brand new?
Candida is a commensal, right? So we all have candida. Candida
Right.
is everywhere. And what we also know is that mycotoxins are transferred in utero. So essentially, these babies take on mom's toxin load. And then on top of that, what we also know is that mycotoxins concentrate in the breast milk. So every time the baby comes to nurse, they're just getting a good whopping, dose of mycotoxins, which degrades their gut integrity.
Wow.
One of the things that's so fascinating is there's this entire phenomenon of immune mediated dysbiosis, where the immune system causing inflammation in the gut. So the mast cells, it seems to be, the primary actors that cause the mess. When they get activated by mycotoxins and whatever else, they start triggering inflammation in the gut. And the inflammation they cause essentially causes this perfect environment for everything to go south. And it's like a lawn that doesn't get watered and has acid sprayed on it. So any beneficial grass just dies off, and all the nasty, weeds that are left that are resilient to the acid and, drought start flourishing. And one of the things there's this really cool study. I think the author's name is Renga, Renga, where they looked at the behavior of candida to mast cell activation. And one of the things that they found was when mast cells become activated, so when the gut is inflamed, that mast cell activation actually signals, it triggers the candida to go from the benign kind of form to this sprouting hyphae state that is actually very irritating to the immune system. So it starts becoming invasive, and essentially it's like it starts putting roots into the gastrointestinal tract. And through that, along with this inflammation also throwing off the bacteria, so all the beneficial bacteria start dying off, and all the not helpful bacteria start growing. It creates this pro-inflammatory state, which then causes even more inflammation, causes more leaky gut, causes more food sensitivities, and it just becomes this awful vicious cycle that has no end. And one of the things that I believe in, Dr. Nathan and others are of the same mindset is when we use antifungals, part of what we're doing is reducing this fungal load, getting rid of candida that's triggering all this inflammation. So the gastrointestinal tract actually has a chance to start healing.
And one other insult to injury that I want to add is we also are a society where we use so many antibiotics,
Mm.
and the antibiotics is just attacking the bacteria. And then in your gut, so when we have an ear infection, we have, we have SIBO. That's like the biggest one. And all the research with SIBO show that a lot of people that actually have SIBO, I think it's at least 50%, also have small intestinal fungal overgrowth, but there's no good way to test that. And so what people end up doing is getting on antibiotics, and then you're letting the fungal grow without any competition. And it's just a lot worse, because then you're literally killing off the good and bad bacteria. Maybe you'll take some probiotics, but you're then allowing fungal overgrowth to just spread everywhere, and it just gets far
Yeah.
worse, and it just makes
Yeah.
people. And I think that's why a lot of people, they do rounds of SIBO treatment, and then they even change their diet, and they're not getting fully better, because I think it's actually a fungal overgrowth and they're taking the wrong medication.
Yeah. Yeah. Or people take the antibiotics, they feel momentarily
Yes,
better,
yes.
right? They get better for a week or two or a month or two, and then everything just goes south.
Right.
Um, as you were saying this, what I was thinking of is a lot of these kids that are diagnosed with PANDAS, which is the neuroinflammatory condition tied to strep. And God, I've had, sadly more than a handful of kids that, came to me because they were on antibiotics for a year and a half. And the second they would take the antibiotics off, everything would just like come back with a raging, you know, uh, degree of inflammation. And their inflammation shows up as aggression, anxiety, OCD, rituals. And unfortunately, what was missed in all these kids was mold, because everyone was looking for all of these other things, mycoplasma and strep. And
Mhm.
so they would throw an antibiotic for this, throw an antibiotic for that. And, with antibiotics, they have anti-inflammatory properties. So they're using these antibiotics as anti-inflammatories, which help when they're on board. But the second the antibiotic is gone, the fungus and, everything kind of just blossoms even more, and they're in this vicious cycle that just has no end. So your point is very well taken.
Have you had patients where they're suffering from PANS or PANDAS, and they get on some type of antifungal and they're improving greatly, and they're also getting out of the environment?
Yeah, yeah. And It's only been in the last 6 months, with the nudging of one of my other mentors, Dr. Campbell. And Dr. Andrew Campbell has been a huge proponent of itraconazole for years. So finally, I got to a point of having enough courage to open my eyes to what he was saying. And as you know, Dr. Campbell doesn't totally believe in the use of binders for detoxification. I think that's another story. But I started using antifungals, specifically itraconazole, and the outcomes that I had were borderline weird in terms of how positive the changes were. Like kids with PANS and PANDAS, like 3 weeks later, suddenly not flaring and totally calm. Urinary issues improved, sleep issues improved. I have several kids now on the autism spectrum where the autistic features have, gone away within several weeks. And, mind you, I don't just do itraconazole. Like, we're taking care of the environment, we're addressing the gut, we're using other anti-inflammatories. So I kind of get the kids set up, and the itraconazole is kind of what I do to really clean things up. And it's like 6 months into the treatment. And what I would add to this is my own personal experience. So watching these kids and looking at how well they responded, I got to a place where, I went back and looked at some organic acids that I did from 2 years ago. And I'm like, gosh, there were some fungal markers over there that I didn't really notice. So I tried it on myself, and I kid you not, like, weirdest experience of my life. And I've tried B12 injections, folate, like anything and everything that you can possibly imagine. I've tried on myself, and within 2, maximum 3 weeks, and this is only every other day dosing, my nervous system was the calmest it has ever been in my entire life.
Wow.
Like, to the point where 2 years ago I was the one that would get triggered easily and have a fear response or become irritable, angry at times, and would really have to be mindful of my emotions, to the point where now it's like, God, I actually don't feel the need to, like, my wife may do something, or someone will do something that could be irritating, and I'll just stand there and be like, no, I don't need to respond right now. That response would not be helpful. And, like, the prior version of me would have never responded in this way. Like, I would have to work so hard and use so many mindfulness techniques and, so many things to mitigate that response. And now that response is not there. So these antifungals, I think, have a very large uh, potential role in helping a lot of people who have been impacted.
So I'll have to bring it up. Obviously, Dr. Shoemaker is not the biggest fan of azoles, and I'm still on the fence about certain things now, just that I've been in the SIR space for a little bit. I'm curious though, after you use the azoles and you found that improvement, has it continued? Do you feel any differences that may be not positive?
The positivity is continued. The thing that I'm trying to really figure out now is how to make it permanent so that they don't have to be on it. Because sadly, what's so far has happened, there have been a handful of kids that have come off of it after 6 months and they've done great. And then there are other kids that we take it off, and then 2 or 3 months later, they kind of fall back. Um, and I think the people who don't respond well are the people that are either living in large amounts of mold, they have huge amounts of dysbiosis, right? So, I mean, the azoles are bulldozers, and if you send the bulldozer into a war zone, like, bad things are going to happen. So what I have learned to do is meticulously prepare the child's gastrointestinal tract, prepare their microbiome, prepare their organs of detoxification, get everything set up as well as it can be, so when the azole comes in, that child's body and microbiome and mycobiome and gut can actually handle it. Because a kid who, or anyone, I believe, who has been exposed to large amounts of mold and their nervous systems are buzzing high and they have huge amounts of fungal imbalance, and everything else is a best. You throw the azoles in that's a recipe for very bad things to happen. And I've seen that.
You know what's interesting is recently I saw a few articles that shared they're starting to use the azoles, especially intraconazole, for cancer. So I just wonder, could it be a overgrowth of fungus in the body, but they're, seeing it as cancer, but they're using it for cancer therapies now because they're seeing a benefit and eradication of the tumor. I'm just saying
Yeah.
it's
It's wild. It's wild. But like as I started seeing this, I asked like, well, what the hell is going on? Because it didn't make sense that these azoles are just behaving as antifungals. And then I started finding studies looking at inflammatory bowel disease going into remission and various kinds of autoimmune diseases going into remission and all kinds of other things being impacted by these azoles. So these azoles are not just antifungal, like they have obvious antifungal properties, but I've become a huge believer that they have anti-inflammatory effects that go well beyond their antifungal effects. And I think that part of what they're doing is by reducing the inflammation, especially within the gut, but also, the larger cascades within the system, they're actually allowing the gut to finally start healing. And I mean, if you think about it, like if you've got someone who has horrendous leaky gut, right? So all of these endotoxins and other toxins are constantly seeping through the gut, and they have, all kinds of different inflammatory processes. And when you look at like the Th1, Th2, skew, that's a setup for cancer, right? Because the immune system is so off balance that the last thing it's paying attention to are any kind of cancer cells that are sprouting, right? So as you balance this Th1, Th2 response, you reduce the toxicity that's coming from the gut. And I think that at least in the kids with autism and some of the other children that I see, the ghost that's lurking in the background behind the mycotoxins, not to say the mycotoxins aren't a problem, but the ugly larger cousin that's perhaps even more destructive are these bacterial endotoxins that can easily leak through the gut, go all the way through the system, trigger all kinds of weird inflammatory conditions within the system, within the nervous system. And as these azoles help shore up the gastrointestinal tract and reduce the gut inflammation, part of what we do is we reduce the toxin load, we normalize the immune response, we finally allow the immune system to wake up, and it's like, oh, whoa, there's cancer over there. Let me get rid of it. I think we're barely scratching, the surface of what is going on. And like part of why I'm so happy to be here is to have this conversation with you and for us to learn like how do we really help all these people?
Yeah, and I think the hard thing is whenever I share mold, it's everywhere. There's no control that we have over it. Why do you think mold is making us sick today when even in the Old Testament it shares that there was mold? So why now is it an issue?
Great question. I wish I knew everything about it. I certainly don't. I believe there are multiple different parts. First of all, this human experiment with all of these other toxins that we now have. So the human gastrointestinal tract, the human microbiome, has never been this compromised in the history of mankind. Like we've never had this many things disrupting our gut. And I think we are born into this world, and those of us that are as adults living in this world, this toxic burden is creating a gastrointestinal tract that's just much less resilient to handling the toxic load that comes at us. So our ability to handle toxins is less because, as you wisely pointed out, our toxic bucket is fuller than it was ever in the history of mankind. I think the other part of it is, what's happened with our indoor space. I think back to, 20 years ago, every window in a home would leak, right? You didn't have a window that closed perfectly, right? You close your window, there was like a half-inch gap, which means like buildings would just breathe a lot more. And what seems to happen, and this is what a lot of the environmental professionals talk about, is as building standards have gone into energy efficiency, which is a good thing in many ways, we've also created these closed environments that do not breathe in any way, shape, or form. And if any kind of moisture problem enters this closed, you know, environment, all that toxicity gets trapped. and the mycotoxin load and the toxic load. And it's not just mycotoxins. When I'm sure you've already, come across and talked about this, we have bacterial and endotoxins. We have a host of other volatile compounds. Like there's this soup of toxins that gets released when there's contamination in an indoor environment. And this constant circulation of these toxins within the environment that we spend, 10, 12 plus hours in, creates additional toxicity, which then tips us over.
Yeah, no, I think that makes total sense. And I think it was more noticeable during COVID when everyone was locked in. You're not having community, so you're not having that outlet, and people are in their house. And if there was water damage, you're just getting exposed because people weren't going outside. We weren't supposed to go outside. So I can see how so much of that. And it's funny because we need to replace our windows because they are showing that they're not airtight and it's affecting our air condition. And my first thought is, I think I shouldn't change my windows for the ability for the house to breathe. So it's so ironic. Are there other symptoms that you didn't bring up that for children, especially, that may be related to mold when children are older and they're still bedwetting? I hear that that's one of these symptoms, but is that one? And then are there any other symptoms that we didn't bring up?
Kids who bedwet with no other issue, I would say maybe there's less likelihood that
Okay.
it's mold. Oftentimes, what I find is the child has distractibility and they have inattention and they have focus problems. So, a lot of these cognitive issues that we associate with ADHD or, oh, this kid has a learning disability, when you really drill down into it, and Dr. Campbell actually published a really beautiful study where he did this kind of review. And what they found was children who were exposed to mycotoxins for periods of time developed all kinds of weird learning and attention problems. So, inattention, hyperactivity, processing errors, issues with executive functioning where the kid, tries to sit down and do their homework and 4 seconds later between their hyperactivity and attention, like it takes an act of God for them to do one thing. One telltale sign that I see in a lot of kids are issues with working memory, which specifically creates a problem with math. So if you think about it, math requires RAM, right? Your brain has to like 2 plus 2. Okay, I remember 2 plus 2 is 4, and then you build on that, right? When that RAM, that working memory of the brain, is altered and it's not effectively working, these kids end up with all kinds of weird learning issues. And I see this all the time. And when I see this in a kid, the kid has hyperactivity and they can't sit still. And a lot of times that hyperactivity are related to vestibular issues. And the vestibular issues are ultimately tied to mast cell activity and histamine imbalances. Like between that and the focus problems and the processing issues, like at least in my practice, a majority of the time, maybe not always, the majority of the time, that's mycotoxins. One of the other things that I see as a very strong indicator of mycotoxins or mold exposure are sensory issues. So these kids that have auditory processing errors, where the first thing is they just freak out, and there's probably some adults out there and they're listening. You're like, wait a second, that's me. And I used to have that, and I still have some sensitivity, but nothing like before. But if someone goes into a loud or crowded environment and they just want to get the heck out of there, or they start having anxiety, so we attribute social anxiety. But when you look at what drives social anxiety, the majority of the time, it's actually the person has an auditory sensitivity, and they just can't be in these loud environments, which is also part of that same histamine reaction. Along with that, sometimes we'll see tactile sensitivity. So kids can't handle, their hair being washed. They're very sensitive to the clothing they wear. That tactile sensitivity shows up in the mouth. So a lot of times parents are like, yeah, my kid was fine. They were eating everything. And then when they turned 5, which is the same time they developed anxiety and aggression and hyperactivity, they started becoming extremely picky. And when you say, well, God, what would cause a kid, or, there's some adults out there that are probably experiencing this, what would cause a human being to be more picky, right? Why would that palate suddenly change? And I've had some older kids where I've talked to them. I'm like, what does meat feel like in your mouth? Oh, it's disgusting, and they're like, literally, it's like, oh, that's
Like
disgusting.
rubber.
Yeah, but it's the texture, and we think like, oh, a piece of steak, that's so delicious, right? A piece of salmon, that's so delicious. For these kids or individuals that experience, whether it's the chewiness or the squishiness, like these foods just feel absolutely gross to them. And because of that, they stop, either their appetite drops off, which can also happen, or they just become extremely picky. And then what happens? Well, what happens with a lot of these kids, they start eating mac and cheese and chicken nuggets and pizza and peanut butter and jelly, which obviously becomes a greater inflammatory burden to the gut, which worsens the inflammation. And then they just get stuck in this vicious loop.
Of the percentages of children visiting you, what percentage would you say is suffering from some level of mold illness?
So, uh, I have to be honest that I think I've become so biased to finding mold. And I'm sure it's also because I've attracted this community. I mean, most of the people that show up at my doorstep have heard me, talk somewhere, or if they've read a post that I've, put out there. So, in my practice, I'd say 70, maybe 80 plus percent of the kids ultimately have mold. And again, it's not always, because every now and then it's like, oh gosh, that's Lyme, or oh my God, this kid has a horrific, tapeworm, infestation. I've seen those too. But sadly, mold is, at least in my practice, extremely common.
And I could say, even in our more mostly adult practice, where a lot of people are doing elimination diets because maybe they had an autoimmune illness or they had some type of chronic illness ever since they were young. They were the children that were always kind of a little bit sick. And then so they're doing this elimination diet because so many people with autoimmune have shared that it's healed them. And then they work with me when it's not working well enough. And ever since learning about SIRS or mold illness, we have also seen, I think the percentage is about 70 to 80%. So a lot of people don't even come to us. They're just like, carnivore's not working enough. I think it's my gut. My gut is, in disarray ever since before carnivore, and I thought it would fix it. It's not. My autoimmune's not fixing, and so help me fix this. And then as we see now, we see, they're individual, but you see commonalities. Like, oh, you had the common ear infections when you're a child, the stomach aches, the headaches, the EBV is another one that I see often too. It's just the toxin bucket, and yeah. So I think it's our practice, although it's more nutritionally, gut health, fixing it with an elimination diet, it's all of a sudden turned into this, oh, we are diagnosing people for mold illness. And what I will say though is that everyone won't heal with just mold illness. We will then see, oh, like you said, the inflammation goes down, and it's like, actually, you have chronic Lyme that you have, your immune system was not able to notice, or, oh, your mast cells are now really dysregulated, and we need to figure out how to calm those down, because now you have reduced the noise from mold illness, but you are still suffering from sensitivities. And it's because your mast cells are now hyper vigilant, and it's now figuring out how do you calm that. So there's still a lot. I don't want to say everyone just needs to do mold, because I have those glasses on too. But what we see is, yes, it will move the needle a lot, just like diet will move the needle a lot, but it's not the only answer.
Yeah. And I commend you for holding the space for all these poor adults that have been impacted, because, part of, I've got to say, that why I love working with kids is, like you said, they're so resilient.
Yeah.
And unlike us adults, and I've had to do a lot of, trauma work on myself, but like, unlike us adults, they don't really hold trauma. And, the same limbic retraining and all of the stuff that I even have to do with some of the adolescents and teens that have been affected with the little ones, and they're 80 to 90% of my practice. Part of what I love is, I just balance out their gut and do a few things. And then all of a sudden it's like, voila, like a new kid just pops up. I'm like, oh my God, that's so cool. So I commend you for really holding the space for all of us adults that don't have that resiliency, because we're a little bit more broken and toxic, right? We need we need a little bit more TLC to get to where these kids get to quickly.
I think that when people go through their own trauma or their experience, it causes them, or for me, it was my own trauma with being really sick. But I do know that I got my health back. And what I do know is that my life was very dark and I had suicide. I was on a 72-hour hold against my will. So there was a
Wow.
lot of trauma in my past. And
Wow.
there was moments where I was going through really bad postpartum depression where I just would tell my husband, I just wish I don't want to wake up because every day is the same. And I feel like I'm in this house. And I didn't even realize I was going through depression. And now that I know what health tastes like, I will never take it for granted. And knowing that, I thought diet would fix everyone. And so I wanted to share and be that person until I work with individuals and realize, oh, there's all these other things that I don't know the answer to, but I'm willing to search because I want you to get your health back like I did. And that's when inevitably I ran into mold because you cannot ignore it once you see it. I know it's not the easiest answer for adults, but we have crazy healing stories of
Mm.
some people that are willing to even go live in a tent and they have healing from it and it can give you your health back. And if in this world you can get your health back and have vitality and do the things you want, I will stand that ground. Even if it's hard, it's not as simple as just doing an all meat diet. But I think it's so important because you hear the stories of going to 20 doctors and spending so much money and not knowing what's wrong or not even feeling a little bit better. And so it's just, I don't know, maybe this is my role I'm supposed to have in this life, but I'm all for it. And honestly, I wanted to be a pediatrician. So my heart has always been with the children, but I thought, and I realized very quickly, especially in the diet space, if I don't work with the adults, it'll never trickle down to the children. And so my goal has always been if I could work with the adults, the children will naturally be taken care of. But I love that you're working with children because, like you said, they don't get a choice of what house they get to live in or the food they're fed. But if we can educate and teach now, they get an opportunity for 70, 80, 90 years, get to live a much healthier life as long as we can teach early.
Yeah. Yeah. And as thank you, first of all, for sharing that story. It touched me because, gosh, I think back and I think in my adolescence, I'm pretty sure we had mold because I went from being a relatively happy-go-lucky, 7-year-old to a 8 or 9-year-old that was very dark and very unhealthy. And I to your point and to your kind of message and story, I just think of how much good could we do if we just get more of this information out there. And if someone had intervened in my life earlier on, um, like what would the trajectory of my life had been, for the 20 plus years that, I did struggle. And, I like to your point, I believe that my struggle was necessary to bring me here. So I wouldn't take it back. But there are a lot of kids who give up on life. And I mean, we know that, while you and I were lucky and we didn't get to a place where we did take our lives, sadly, there are a lot of kids that do. And I see a lot of kids, they just give up where, they just come to conclude that I'm dumb. And like, I mean, it breaks my heart. And I still see kids who are like, I'm just dumb. And what they attribute to themselves with this awful kind of mindset is not that they're dumb, it's they're toxic.
Right.
And they and their parents don't know the difference. Or a lot of these kids with pans and pandas, they come to attribute themselves as, oh, I'm just bad, right? No, little person, you're not bad. Your body is inflamed, and sometimes when I talk to these kids and I'm like, no, you're really, really smart. It's just your brain just can't learn right now. And they're like, yeah, my brain can't learn. Or you're actually really good. It's just sometimes your brain causes you to do something you can't control. And then, the parent starts crying and the kid is like, yeah, my brain sometimes does make me do things that I can't control. And it's just, I mean, it's heartbreaking. It's I'm sure you see this in adults. It's the amount of suffering that's out there is so profound. And part of why I was so grateful to join you on this podcast and conversation is I truly believe, as do you, the more good information we can get out there, and the more people that can say, oh my God, maybe this is happening to me, maybe this is happening to my child, we can, turn this around. We can, just like what you said. Like I've had, Jesus, I don't know how many hundreds, if not thousands, of kids that had learning disabilities, and now a year later they're at the top of their class. The kids that have had debilitating anxiety and couldn't step foot in forget about being on a stage. They couldn't even step foot in the classroom. And then a year later, they're on stage in front of a group of 300 people doing a performance. To the point where they're like, who is that kid? But like, that's the beauty of the human body, right? The resiliency is there, the light is there, the love is there. And if we just take all of this gook that's blocking all of that, beauty to come through, there's so much good we can do. So thank you for creating this space and just having these conversations to help people learn.
I mean, selfishly, I think I love picking other people's brains, and I get the opportunity to talk with you when maybe in any other situation I would not be able to. So I feel that I get to selfishly talk with other people that are brilliant and pick their brains, and then other people get to learn with me if they choose to. So thank you so much for everything that you do. I wanted to ask you a question about, so a lot of times mold illness impacts testosterone and cortisol because there's constant inflammation. Does that affect then children's development long term? So not just the neurological, but could it affect their growth and their abilities to grow because it's impacting their hormones?
100%. I see as a significant contributor to failure to thrive. So those kids that have dropped to like the 1 percentile, fifth percentile of height and weight. So far, every child that I have seen with that has had mold exposure. Exactly why it happens and how to reverse it is something that's been difficult. I've been able to get the kids to put on weight. So a lot of those kids start climbing to the 10th percentile, 20th percentile when they were in the 0.1 percentile or 1 percentile. Rebalancing their entire HPA axis and restoring hormone balance is something that I'm still learning to do. I wish I could say, yeah, I've had a bunch of kids that were like, 1 percentile, and then all of a sudden with height, and now they're growing like weeds. It's really hard, but I've definitely seen that happen for sure.
Autoimmune and mold, is there a correlation that if someone has autoimmune illness, that they might be suffering from mold illness?
All the time. Yeah. Yeah. I mean, like at the end of the day, if the gastrointestinal tract falls apart, then it's a free for all for all kinds of autoimmune phenomenon. At least 30%, maybe 40% of the kids that I see who have been affected by mold have positive anti-nuclear antibodies, because I check in on all the kids, and I use the ANA as a measure of like how disrupted the gastrointestinal tract and immune systems are. But I find that all the time, at least 10%, probably more, of the kids that I see that have been affected, and we're talking 8-year-olds, 10-year-olds, 12-year-olds, have Hashimoto's. They have thyroid antibodies. Their thyroid peroxidase is positive, sometimes like really positive. So autoimmune phenomenon can happen all the time. Kids get reactive arthritis where their joints start swelling for no reason. I've seen, several cases of that. All kinds of weird dermatologic issues, and not just eczema, but like weird psoriasis or other things like that show up. So yeah, I see that in the kids all the time.
Yeah, we see Hashimoto's so often in our practice, especially with the older women. And it is now a red flag that we see, okay, this person may end up having mold illness. It's a high likelihood. We don't say that at first because we don't know for sure, but it is a very common symptom we are starting to see. Is it's not that everyone that has Hashimoto's has mold illness, but if you have Hashimoto's and there's consistent autoimmune in your family and your mother and your grandmother have it, there's a higher, at least in our practice that we've seen, that are suffering from mold illness.
Yeah, yeah. I'm curious, how do you assess mold toxicity or exposure?
So because I trained under Dr. Shoemaker, we do more blood work. And so like let me take a stand
Mm.
for the people that are listening and watching. I believe in just sharing information so that ultimately people make their own decisions, right? Whether it's a urinary mycotoxin test or a blood test, or using azoles, or ultimately people need to make their own decisions and in their care. I think so, at least. And so the way that we test, what we have found, and this is the part that's hard, is the urinary mycotoxin test can give you a clue if someone, and it's much more affordable than the blood work, can give you a clue if somebody is suffering from mold illness. But what I can tell you is we had a client that was super sick. They did a urinary test and it was clean. So we're like, oh, you don't have mold. This is good, right? I think 6 months went by, and then I learned about SIRS and doing all of the blood work, the HLA genetics, the MMP9, C4A, all of those other markers. And lo and behold, they had one of the multi-susceptible genes, and all the blood markers were high. And as they went through that protocol, they got better, but their urinary mycotoxin test never showed it. But then we also have other people where they will do the urinary mycotox test, and it's Christmas tree, it's black everywhere, or whatever color they use now. And so then we also do the blood work and it lines up. So the concern I have with the mycotoxin is it may miss, so it might have a few false negatives. And we don't also know if it's a healthy response. Like, what if they're just having a bathroom break of the bad corn or soy or grains they ate the night before? What would really be ideal is if everybody that ate the same thing in the family all took the urinary test and then did it the next day without eating, like going on a mold-free diet test, and I think that's the best way to use that. But then that becomes expensive anyway. And then why not try the blood work, which I know the blood work is not available everywhere. So that's also a complex issue. But
I love what you brought up because I actually have gotten to the point where I've stopped using urinary mycotoxins.
okay. Oh, okay.
This is just pediatric. So this is not to say that this is relevant to adults. So just
Okay.
keep in mind that my brain only focuses on little people, not even like big little people. So to your point, what I found in the kids is, first of all, dietary influence is huge.
Yeah.
And I've had several cases where you get the mycotoxins, you're like, oh my God, like they must be living in horrible amounts of mold. And then, you check and you're like, oh, well, he did have some peanut butter and he does love those, he does love corn. So you get rid of peanut butter and gluten and dairy and corn and stuff like that. And then like recheck 3 or 4 weeks later, and all of a sudden it's like, oh, no,
Right.
totally clean. And to your point, what actually got me to start steering away from the urinary mycotoxins was the fact that I had several kids, like it wasn't one, probably 20, 30 plus kids, where I did the urinary mycotoxins. They didn't look terrible, a
Right.
little spike, but not to the point where you're like, oh, this must be mold. And then sure enough, like horrendous amounts of contamination, like have to like run out of the home kind of contamination. And what I came to believe, and who knows if this is correct, is a lot of these kids, when they get toxic enough, they just lose the ability to
Yeah.
really push the mycotoxins out through their urine. And, after having Dr. Andrew Campbell kind of whisper in my ear, like, hey, I don't trust those toxins, I actually started moving more to the antibody
Mhm.
testing that he really promotes. And whether I use my Myco lab, which is Dr. Andrew Campbell is affiliated with, or you can actually check antibodies against molds themselves. So Aspergillus, there's a company called Allotest that actually will check IgGs against Stachybotrys as well. And for $200, their basic mold panel has become my favorite go-to. Um, I say its accuracy is about 80%, which was better than the urinary tests. And usually that's if I can poke a kid, that's what I use. But I think to your point, like there's no perfect test and there's no perfect way to assess for mold toxicity. And I mean, that's part of, I think, the limitation of where we are right now with mold medicine.
Yeah, I think the goal is eventually, if the child or the person is having less symptoms, and if you track all your symptoms, then you know that you're headed in the right direction. So if we know that most buildings are contaminated, and then homes had, if you've ever had water damage, some people are just more susceptible to getting sick. And if they breathe it in, like you said, it goes through your lungs and then it can affect anything. And I mean, fungus can grow in your intestines and literally, I think everywhere in your body. And so it's, if you start treatment and you start feeling better, and obviously you have to work on the environment, but I think that's a good indication that's probably part of the story. The way that I really think of mold that makes so much sense to me is mold has a purpose in our lives. It's to decompose things so that new life can begin. And we don't want to decompose earlier than we are meant to. And mold is just doing the job that it's supposed to do. It's trying to bring in new life. And if we understand that, then obviously it's so toxic for our bodies. And if we can at least let people know that, because I hate when people go, oh no, that water stain there is not a big deal. It's not black mold. And it's like, no, all mold is not ideal. And it's just, we need to get away from that. And I had this person that's, going on the hill and fighting for our rights, because if the government acknowledged that this is a serious issue, think about all the military homes. And I get pictures of military families showing me mold in their homes, and they are forced to live in there with their young children because they have nowhere else to go, and they are serving our country. And I
Mhm.
just am so heartbroken because they literally cannot do anything. And
Yeah.
it's rampant everywhere. And it's just, how do you solve for that? Because it would cost a lot of money to redo all the buildings and homes and all the codes, and then the insurance payouts. And I think that's what is really the big challenge. And that's why they've done such a great job in teaching people that mold is not that bad.
Yeah. And I mean, gosh, like how much money are we spending in healthcare, right? Medical costs, hospitalizations, biologics that cost $30,000 a month, right? To control the disease processes from this mold exposure. And if we only opened our eyes to your point of like, what is this, exposure costing? Forget about causing, right? We talked about all the suffering and, disability and, like in talking with Dr. Andrew Campbell, and I'm on board, and my mentor Dr. Nathan also agrees, and pretty much everyone in the pediatric mold world are kind of the same mindset that we believe that perhaps upwards of 50% of what we call autism is mold exposure. And when you think of we're spending what, a quarter, if not half $1 trillion a year taking care of these poor individuals that have disability from this condition, and then you add to that everything else, if we took 1% of all of this medical expenditure and use that to take care of the homes and cleaned up the homes and said, yep, you've got mold here, we'll pay for it, because at the end of the day, the 30 or $50,000 that would be spent cleaning up this home is probably a fraction of what we are sadly willingly paying to take care of all the disease that's coming from it, right? So it's a backwards kind of mentality. And I belong, to the medical advisory board of Change the Air. And, these brave souls, Brandon Champo and, everyone else, they're so courageous in trying to move policy. But we joked around. We're like, yeah, it's kind of like we're in the 1980s maybe of cigarettes, right?
Yeah,
Where doctors were smoking on TV, and you'd walk into a clinic, the doctor was sitting there smoking while they were doing their medical exam of you. That's kind of like where we are right now with
totally.
mold, and hopefully, in 20 or 30 years time, we'll as a society and as a community, and especially as a you know at the policy level, will wake up and be like, oh my God, like forget disability. This is just costing us an arm and a leg. So let's put some money to fix it.
In a perfect world, I would love for the HLA genetics to be tested on every single baby that's born. So, like,
Mm.
you get a genetics of the susceptibility of having this chronic illness. So maybe your immune function is not the best in letting the other side know that there is an inflammatory response. And I think if we know that, then we know that this child having a certain genetic type, the HLA genetic type, is more susceptible to mold, to Lyme, to vaccines, to any injury of toxicity of this person probably needs to eat organic or eat certain things. I think that can do so much. And so I would love for every parent to be required, because all it is one poke, and then you get that blood work done, and it would have it will not guarantee if this kid will get sick or not. I suspect that the majority of chronic illness sufferers have a genetic type. And if you could just test that from the beginning, you know that this child, you can save them decades of harm by just knowing that they are a little bit more sensitive, and then you could be much more mindful. And I think that can do so much. But obviously fixing buildings is like the bigger root cause issue. I totally get that.
Yeah.
So
No, I love where you're going with this, and that would be a pretty awesome idea. Here's something trippy. As I kind of went down the rabbit hole of this entire gut kind of mediated inflammatory response and toxicity, what really tripped me out was it turns out that the HLA haplotypes, and it seems like some of the HLA haplotypes that are related to mold vulnerability, for instance, are also tied to gastrointestinal inflammation. Because when you think about, these HLA subtypes, essentially these HLA subtypes are priming, they create different immune responses, right? And within these immune responses, because the immune response ultimately influences the bacteria that we have in our gut, and it influences the way the gastrointestinal tract is maintained or not. There are several studies out there that have looked at how different people with different HLA subtypes actually have different microbiomes and different gastrointestinal responses. So, one of the things that I wonder about, and who knows how accurate this is all of these people that have the HLA subtypes that predispose them particularly to mold toxicity. Is that because their HLA subtype has created a vulnerable gastrointestinal tract microbiome milieu that then allows them to become so vulnerable to this exposure once it happens? It's something that's really fascinating. I don't think we know for sure, but I can tell you, at least in the kids that I take care of, what I see as a common thread is most of the kids that have ultimately developed mold toxicity, it's because their gastrointestinal tracts just kind of went kaput and everything just started falling apart.
we've seen people that will work on their gut first, and then they improve so much, and then we find out later they have mold illness, and so that's what's not getting them to the like A+ grade of level of health. And so that then the gut healing that they've done before, so strengthening the microbiome, the barriers, and then working on mold illness, but both of those combined really helps them to just get a lot better. We've also had people that are like, no, I know I have mold. Can I bypass everything and just go to mold? And they've done that, and their gut never improves. And there's a working theory also that when you suffer from mold illness and you have the HLA, the communication between the innate and adaptive side are not going really well together. And so that then impacts, eventually the innate side is trying to get the adaptive side to do stuff, and it's not working. It affects the pituitary, the hypothalamus, that area, which then ultimately affects your melanocyte stimulating hormone. And that MSH marker absolutely impacts your gut function. So if you look at the MSH marker, it can, if it's down regulated, which often is in mold illness, when it's down regulated, it absolutely causes more leaky gut. So I hear what you're saying with the mark. I don't know, is it the chicken or the egg? So is it that your MSH is low, and you can totally test that in children too, but it's blood work. Is the MSH low, which then causes you to have leaky gut, which then exacerbates mold, but it's the mold that's exacerbating your MSH to be low. And so it's this conundrum. I don't.
Or, I mean, I think as you're sharing that, really what it brings up for me is just how intimately everything is tied to
Totally.
everything else, right? So one thing causes one thing. It's like a stack of dominoes, right? Once one domino really starts falling, everything else starts falling, and it just keeps compounding the issues. I mean, I think we could take the same conversation for the mitochondria, for instance,
Totally.
right? Once mycotoxins and these toxins hit the mitochondria start falling apart. They cause oxidative stress. That oxidative stress causes more inflammation. So I think as you shared that, what was going through my head is I think the complexity of mold related illness is it's never just one system. And as much as I go to the gut, like to your point, it's all the systems that are affected. And you do have to look at the human body holistically to help these people.
And the gut is so important, but it is so I started with gut function too, with the carnivore diet gut function, but the neurological, it's just all of it's connected. The vagus nerve connects and decides what the gut will do. And then it affects, are you going to be in a parasympathetic state so you can rest and digest and have your immune system be more robust? So I think it really just comes down to there's so many facets for healing, and it's not just one thing. With littles, I think it might be easier to just start with one thing. But what do you recommend? If I was a new patient of yours and I had a little one that is presenting with symptoms that seem moldy, but I'm not entirely sure, like what are some stuff that I can do to start taking care of my children? Like what tips would you like to leave in from this conversation of, someone that's watching this thinking, that sounds like my child, or that even sounds like me. I'm renting, or I don't even know if I can afford all of this. Like, where do I even get started? Because I definitely am struggling with a lot of the things you mentioned. That kind of sounds like me. I kind of don't want it to be me, but I'm not getting better with any modality that I've used. What would you say to that person? It could be tips, it could be like the protocol, the detox, whatever you'd like to share.
The first thing is, which, I've heard you really kind of bring forth is there's so much healing that's possible if you can just find someone to work with that really understands what's going on. And I think just like with you, I mean, part of why I am so passionate about all of this and why I'm so happy to be here to share is that the types of healings that I've seen are borderline, like I'd say insane, where things that should not heal have healed. We have this kids with horrible eczema, kids with learning disabilities, autism, pans and pandas, inflammatory conditions. I've had kids with, Hashimoto's that they were on the way to having thyroid failure. Now, 3-4 years later, not still being on thyroid meds and growing and doing perfectly well. So I think that, first of all, there's so much health and goodness that can come from this conversation. So it's not like, oh my God, this is doom and gloom and this is awful. It should be like, shoot, this may be the answer that I've been looking for forever.
Right.
And now it's just a matter of figuring out how to put all of this into action. One of the first steps that I use for a lot of the kids are just simple things like, let's just clean up the diet a little bit. Try to cut down gluten, dairy, sugar, just processed foods. Get rid of the crud from the diet. Use easy, basic, safe anti-inflammatories like the DAO enzymes. I'm a huge fan of, because a lot of times, whether it's allergy related issues, gastrointestinal issues, eczema, neurological issues, these DAO enzymes, at least in the kids, can work wonders. There's a supplement called Mirica, Mirica, which is luteolin with this polyamino ethylamide. I can't. You
I'll
don't
put it
even
in the
know how
show
many
notes.
times I've tried to say it. I still can't. My brain has like a psychological block. So PEA also so great at calming down the mast cell activity in the gut, and it's so easy for the kids to take because it's tasteless and just textureless. So basic, easy things like that. Throw some zinc, throw some vitamin D. Like 60-70% of kids will improve even if they're living in mold. And then from there, for me, it's a matter of understanding the environment. So whether someone does an ERMI with, someone they like, I've become a big fan of the dust test because they have the mechanisms to give guidance afterwards. So unless someone is living like in scary amounts of mold, in which case they need to take action, a lot of times what I find in milder amounts, and to your point, people who can't remediate, right, where they're in a rental property, they're in military, whatever, their finances won't allow them. Um, We Inspect has some really wonderful handouts on, do it yourself, just deep cleaning. So people HEPA vacuum, when I tell them this, that they're kind of looking at me weird. until they do it and it works. So like HEPA vacuuming or dusting your walls, right? Because that's where a lot of the mold lives. So decluttering the environment, get rid of all the stuff that can trap the dust and the mold. And then from there, just HEPA vacuuming the heck out of everything, the walls, the rugs, the furniture, run HEPA filters. And one thing that I've become a huge fan of is, and I know there's some controversy around this, so not all the environmental people agree with me, is ionizers. Basically, ionizers are the technology that's been around like 20, 30 years. And the newer technology doesn't produce any ozone, so there's no, bad byproducts that can come. But essentially, what these filters or purifiers do is they emit these little tiny electrostatic charges that we can't sense, but it actually causes the mold particulates to stick together, which actually causes them to drop out of the air, or it causes them to stick to the walls. And then when you do your cleaning, you actually clean it. There's a company called Air Oasis that has smaller filters for bedrooms. And then there's another company called IAP. They have a ionizer. It's a big blue fan, the NPBI 1100, and it's about $700. So that's for like living areas. I've had multiple families where they couldn't get out of mold, so they put these filters in, and I mean they had to spend $2,000 or $3,000 to get enough filters for everywhere. But with that and the deep cleaning and opening the windows when they could, like they started healing and the kids started getting better. So it, there's always a way around
Yes.
problems most of the time. And if we can get smart enough to kind of think outside of the box and have these conversations and kind of look at it like, well, we just need to find solutions. And now it's just, how do we find these solutions to help people?
Yeah, I agree. I think when initially I was looking at the environment, it's like, sorry, the environment has to be pristine. And then you can do all this remediation. And if you have one water leak, which will be inevitable because there's showers, laundry machines, where we do our dishes and eat, if one leak, and again, you're back at square one. I mean, obviously it won't be as bad, but it's just, it seems like this insurmountable hill that you can never get
Mhm.
out if you think everything has to be perfect. So I love that it's a lot, and it's obvious because you work with one-on-one people, you have to find answers and solutions to make people or your kiddos to get better. I'm curious, sometimes we see, so we have worked with some children and the mom will tell the children, you can't have your doll anymore because that has mold, or you can't. And so I see the child get scared of mold. How do we balance that so the children aren't, like, I see even my kids do it and I tell them don't worry, but they'll look around, they're, as soon as we go into a restaurant they're looking, is there black mold, because they hear me talk about it so much.
Mhm.
How do we not get our children's nervous system, hyper activated where now they're scared of going anywhere and they're, inflaming their limbic system even that way?
Yeah. I think it starts with us healing ourselves, right? And I think what you wisely pointed out in terms of doing the limbic retraining and taking care of trauma is really important, because as parents, if we don't do that for ourselves, we end up transferring all of that onto our kids. And I would argue that the toxicity of this, I hate to say behavior, maybe stress is a better way to put it. The toxicity of that stress, and we know stress could be toxic or toxic inducing, is probably more harmful than that teddy bear that has some, mold spores or a little bit of mycotoxins, but it's your kid's favorite teddy bear.
Right.
And it's what they have loved, it's what they're attached to. So I think by calming ourselves and our nervous systems down to allow our own bodies to heal, what also happens is we get to a place where we can be more rational in our thinking. And I mean, I'll be the first to say, like, God, like when my nervous system was inflamed and I didn't realize that I had the exposure, like I wasn't always rational. And the way, and one of the things that happens is the amygdala because of this neuroinflammation and microglial activation that comes from the mast cells. I see this all the time in the kids. Our fear response because of the amygdala and the limbic system is completely distorted.
Right.
So our perception of what is a threat in the world is completely off. And I mean, personally speaking, like I now look back and not because I hadn't done trauma work, I had done trauma work, but I'd never effectively fully addressed my neuroinflammatory response. I perceived everything as a mild threat, whether it was my wife or little things that would happen in my life. And now that I look back, I look and say, like, my God, that was so debilitating because I was constantly on guard. And it was always like, and I'm a holistic pediatrician, and like most people look at me and they're like, oh, he's so calm and he's so balanced and he's so happy. And, I would come across as that, but deep inside, there was this constant fear, this constant perception of threat. And I had to do so much mindfulness work and so much, extra care to try to control it. But now, especially with this Miraca that I now take and I give it to my kids, like between that and the itraconazole, like that fear response is completely gone.
Wow.
And all of this to say, like, a lot of times, if parents could stand back and just watch their own response, and if what they see is, well, God, how I'm perceiving my world is actually not healthy, is really the thing. It's not to place guilt, because I mean, if that's the case, then I need to blame myself before anyone else. But to look at this as, God, this is just not healthy. This is not, happy. This is not at ease, right? And as we look at this and say, gosh, no, this is not necessarily good. And I am throwing my threat response, my fear response into the world and passing that on to my kids. And is that a good thing? And the obvious answer is no.
Right.
How do I mitigate this? And for anyone that's interested, like, uh, you take that supplement if you've been exposed to mold and you have this either anger or aggression, which comes a lot of times from fear. So psychologically, they're connected, or it's this fear of, oh my God, this, oh my God, that. You take this anti-inflammatory. What's really weird is, I'd say within 3 or 4 weeks, usually there's a 30 to 50% improvement, because with that.
Wow.
Hmm.
Oh, that's amazing. I have to tell you, as we're wrapping up, it is an honor to interview you because I've
Hmm.
interviewed over 250 doctors, practitioners, just all over. And I don't think I've ever interviewed a practitioner that is so vulnerable and open and honest and sharing, like, I get it. Like, I get that the struggles, even though I look all put together, that I struggled with this and this is how I'm healing. And that's why now I'm passionate, that your vulnerability and willingness to share and your struggles, it's hard for people to share that because they feel like maybe it loses a little bit of my authority or, just, or my expertise. And it's so not that at all. But I just commend you because it is rare to see that. And I don't think of all the experts I've interviewed, that they're willing to share that. And so I want to take a moment to share that because I can sense your heart and your true compassion wanting to help people, and your willingness to share your vulnerabilities. Obviously, it's not a Dear Diary moment. It's because you want people to know, like, I get it. Like, I get the how hard it is and how much the struggle is, and you can get better, and you can see it in your testimony that you're sharing. So I just want to commend you for that because I have not seen that in all of my interviews I've done thus far.
Oh my gosh. Well, thank you. I'm honestly touched. Thank you. I really appreciate that. And for me, the intention is, if this sharing could help others feel more comfortable with where they are, right? And they can feel more at ease with, what they're struggling with,
Right.
that hopefully through that, light and healing can come about. And if that's the case, then heck, it's all worth it.
I think a true leader is somebody that is willing to be down in the trenches with people and also be able to lead and serve. And I think that's what you're doing. And so it gives people a lot more hope. So I think you are doing that. And I just wanted to share that because I felt it. And I am just a open book. So is your practice only in California? Could people work with you outside of California? Do you do one-on-ones? I know you do, but do you also have groups and social media? Where can people find you?
I appreciate this opening. So I do have a private practice. I have one, so I do see patients, and if patients are out of state, out of California, what we can offer is basically a second consult, where if their primary doctor is willing to work with us to order tests and sign off on the consultation, then I can work with them. And the practice is called Holistic Kids. So WHOLISTICKIDS.com. What I'm really, and then Holistic Kids also is on Instagram. So where all my messaging is, and for those of you that want to follow me there, that's where I post a lot of my videos and what I've learned in, case series and things like that. So it's just Instagram Holistic Kids. The other thing that I'm working on, this is where the bulk of my energy is going, is actually a platform called Holistic Minds. So also WHOLISTIC, and then MINDS. And the purpose of this platform is to enable providers to do a lot more of this work more easily and more effectively. Because I mean, what I came to realize years ago is, I can work myself to death, and I try to see and help as many people as I can, but there are way too many people who are sick, and there are way too many people who are struggling. And uh training courses that are out there, I know, like Dr. Krista and Dr. Nathan, and there's so many wonderful people that are, and Dr. Shoemaker, they're really working hard to train doctors and providers to serve those who are sick, but it's just not enough. Like, we
Right.
can't train people fast enough, and we can't bring them to a high level of expertise quickly enough to really make a big difference. So Holistic Minds is an AI portal that is really meant to augment providers' capacity and efficiency. So what we're doing is trying to automate the hell out of everything. So all the annoying things that we as providers have to do, from sitting there and taking a 45-minute history, where technology can gather a lot of that data. So as a provider, now you can look at the data and be like, hey, is this all true? Yes. Okay, this sure as heck looks like, whatever. And here's what you can do. So we're automating supplement ordering, test ordering, pretty dietary recommendations. We want to automate all of these things so the human being could be the human being that is needed to heal, and not the scut monkey that has to write out a recommendation and type out a million things, and then and then have 15 million staff members that have to facilitate all of the other things. And also, to have the system help people reach a high level of expertise without a decade of training. And our intention and hope is, through this technology, we can empower thousands upon thousands of providers to help a lot more patients, and in the process not get burnt out because they're stressed in working as hard. Because if you can do the same work in half an hour, right, you can help more people with less burnout, and that's really our intention and goal.
If you were a mom or a parent of a sick child, could you also go in there and learn and be sort of your own advocate?
So what we learned is that the human healing bond and connection is critical.
Okay.
And initially we were like, let's just empower parents. And what I realized is, having someone that's there beside you. If you're doing well, you may not need that provider all the time, in which case, paying a very minimal amount. And that's really what we want to do, bring down the cost of care. Because holistic care is because it's so time consuming, right? And as
Yeah.
holistic providers, we have to spend years to learn what we're doing. If we can make it easier for providers to provide this care, and we can allow providers to provide this care with a lot less time, right? Think about like the follow-ups we do. Right now, I spend 30 to 45 minutes per patient per follow-up. And I'm sure it's the same for you, right? If we had a system, which is what we're building as part of Holistic Minds, we have a mobile tracker where it's constantly tracking how someone is doing. If a provider could look at the dashboard and say, hey, patient Z, you're doing great. You ready for the next phase? Yes, I'm ready for the next phase. Here's your supplements. We automate all of these things that currently take time. As a provider, you don't need to sit there for half an hour to learn that someone is doing well, right? You can get that information. But really, all of this to say, I believe that this human bonding, this human connection, this human healing is instrumental. It's part of the healing journey. And part of what we want to do is enhance that and just make it better, make it more efficient so more people can access it and providers can ultimately serve more people with less effort.
No, that makes complete sense. It's taking away a lot of the necessary work, but that doesn't give your care to the patient, but that it's all the almost back end stuff that is required to give that level of care. I was just working on patient paperwork. It took me, and I've been timing it because I'm trying to figure out how to make this more efficient. And it took 3.5 hours, start to finish. And I'm like, there's got to be a way that we have to shorten it. And it's really hard because in order to do personalized care, you have to get into all these nuances. So I totally get it. So that's why that burnout happens. And so if you can even streamline it in any way, that will cause less people to burn out. Because what I see is all the people that are really strong in their space of their specialty, over time, they stop doing one-on-ones because they get so burned out and they just become teachers. And ideally, you want people to still do one-on-ones because that's how you can have a pulse on reality instead of just in papers. So I think what you're saying is so great. I'll definitely take a look at it. I'm interested.
Thank you. Thank you.
And where is that again?
So WWW.WHOLISTIC, so holistic, and then minds, plural, MINDS.com.
Okay. And it's mostly for practitioners, right? To streamline.
So it's for both. So it's really an interface where
Oh,
there's a
okay.
patient interface, there's a provider interface, and basically this becomes the link that helps facilitate all of that.
Okay.
And providers can still have, one-on-one, so they can still do Zoom calls, they can still do in-persons, but really our job is to facilitate all of the data gathering, all the processing the stuff, and also helping the providers see what's going on, right? Because a lot of times, for those providers that don't have the same training that maybe you or I do, is this mold? Is this
I see.
Lyme? I don't know. So to have a system that's like, hey, there's a probability of mold, and here's one or two tests you can do to confirm it. And provider says, God, that sounds reasonable. Click, send, right? And then now the blood test or urine test or whatever comes back, and it's like, oh, that looks pretty bad, right? Part of what we can do is help a lot more providers get into these different spaces that are currently kind of locked out to allow a lot more care to happen more efficiently and effectively.
Okay, so then the ideal state would be that no person would have to see 20 doctors before they get an answer, essentially, right?
Mm-hmm. Mm-hmm.
Okay, no, that's
Exactly.
amazing.
Exactly.
Well, thank you so much for your time. This is a
Mm-hmm.
phenomenal conversation. I appreciate it so much. I think I learned even stuff from you that I didn't know about mold. So it's like a never-ending learning experience. And I do think while it's a complex illness, people can heal. And for children, you can see so much healing so quickly. So thank you so much for the work you do.
Oh, my pleasure. And thank you for holding the space for all of this to happen. And, in our conversation, I learned a whole bunch from you. So, to your point, we will always continue to learn, and there's always more out there that we don't know. And hopefully we can, learn it and do better to serve more people.
Well, thank you. Thank you so much.
Mhm.
Okay, guys, I hope you enjoyed this conversation as much as I did. I truly commend Dr. Pejman for being as honest and vulnerable and real as he is, because truly, I have never interviewed someone that is willing to just put it all out there of their struggles, their demons, their dark side that we as humans all suffer from. But sometimes we don't want to share because it may just not make us look as good. And I think it really takes leadership and authenticity and true confidence in yourself and the desire to serve and properly serve to be able to share that information. So truly, I commend Dr. Pejman for what he's sharing, what he's learning, how he's growing as a practitioner, and all the littles that he's being able to help not have to suffer with chronic illness for the rest of their lives. Like, what an amazing testimony that is. If I lived in California, I would absolutely have him as my pediatrician. But I hope, if anything, from this conversation, you take away that mold illness can be daunting, but it is absolutely something you can overcome. You have to believe in healing and you have to do the hard work. And sometimes it's not easy, but then on those days, have some grace. But ultimately, fight for better health, fight for healing, because you and your children or your future children deserve and truly have the God-given right to have health and the ability to live a life that you are meant to. And once you heal, you can share your mold journey with other people so that other people that are suffering can heal too. And what an amazing mold-free world we can live in. Okay, guys, make sure to eat a lot of meat, take care of your bodies because it is the only place you have to live. I will talk to you guys soon. Bye, guys.